Listen carefully.
Turning 65, you're ready for some relaxation. You've earned it, and bam, you're hit with a choice. Medicare Advantage or Original Medicare with a supplement.
Yeah.
And honestly, both options can feel like kind of stumbling through a haunted house, you know?
I like that analogy.
Yeah.
And just like in a haunted house, there are those unexpected twists and turns.
Right.
Medicare Advantage with its shiny low premiums might seem like the easy path.
Yeah.
But you know what they say about things that seem too good to be true.
Exactly. There are trade-offs, and sometimes those trade-offs can have serious consequences, not just for you personally, but for the entire healthcare system, especially in rural areas. So,
yeah, it's fascinating how interconnected everything is.
Right.
We've got this report Preyed On by Write-Off Warrior
oh yeah.
that really digs into this issue.
Okay.
They paint a pretty grim picture of how certain insurance practices, particularly those associated with some Medicare Advantage plans, are impacting rural hospitals.
They don't mince words, do they?
No, they don't.
They even call some of these insurance companies modern-day Draculas, preying on vulnerable hospitals. But is it really that dire?
Well, their research is pretty compelling.
Okay.
They surveyed 41 rural hospitals and found that a staggering 75% of them identify Medicare Advantage as their biggest payment challenge.
Wow.
Imagine.
75% is huge. I knew it was a problem, but I had no idea it was that widespread.
Right.
And I guess that when hospitals don't get paid, it creates a domino effect, right? It impacts the care they can provide, the staff they can employ, and ultimately the health of the community.
Exactly. Think of it this way. If you're constantly being nickel and dimed, eventually you're going to have to cut corners somewhere.
Right.
And in this case, those corners are things like essential services, staff training, and even the ability to keep the doors open.
This is starting to sound a bit like a horror movie. And remember, before you even get to this point of choosing between Medicare Advantage and Original Medicare, you should be checking out resources like Christopher Westfall's YouTube channel.
He breaks all of this stuff down in a way that even I can understand.
Right. He's a lifesaver for anyone trying to navigate the Medicare maze.
Yeah.
And speaking of resources, the Senior Savings Network is another fantastic option.
Oh, yeah.
They're an unbiased Medicare insurance brokerage that will lay out all of your options and help you find a plan that fits your needs and budget.
Nice.
It's like having a personal guide through the haunted house.
I like that.
Yeah.
Okay, back to our spooky situation. So let's say you're looking at your Medicare options and Medicare Advantage catches your eye with those tempting low monthly premiums.
Right.
What's the catch?
Well, one of the biggest catches is the network restrictions.
Okay.
Unlike Original Medicare, where you can see virtually any doctor who accepts Medicare.
Right.
Most Medicare Advantage plans have limited networks.
Okay.
This means you might not be able to see your preferred doctor or specialist, which can be a real problem, especially if you live in a rural area with limited choices.
That makes sense. So if you're someone who values having a wide range of doctors to choose from,
then Original Medicare might be the better option. Even if it means paying a bit more each month for a Medicare supplement plan to fill in the coverage gaps.
Right.
Right. And it's not just about the doctors, right?
Exactly.
What about the hospitals?
Yeah.
You already talked about how these low reimbursement rates from some Medicare Advantage plans are hurting rural hospitals.
Exactly. That's a huge consideration, especially if you live in a rural area where the local hospital is the lifeline of the community.
Right.
Original Medicare, paired with a Medicare supplement, tends to have better reimbursement rates for hospitals.
Okay.
Which can mean the difference between a hospital staying open or closing its doors.
So it's not just about your individual health care.
Right.
It's about the health of the entire community. And this is why being informed is so crucial.
Absolutely.
You've got to do your research. And again, Christopher Westfall's YouTube channel is a great place to start.
Absolutely. He's got videos on just about every aspect of Medicare, including a really helpful one that compares Medicare Advantage and Original Medicare side by side.
Nice. And don't forget the Senior Savings Network. They can answer all your questions and help you find a plan that fits your specific needs and priorities.
Absolutely.
Okay, so.
Now, another important difference to consider is prior authorization.
Okay.
With Original Medicare, you generally don't need prior authorization for most services, but with many Medicare Advantage plans, you might need permission from the insurance company before you can get certain tests, procedures, or even see a specialist.
So it's like having to ask your insurance company for permission to get the care your doctor recommends. That seems like an extra hurdle, and I can see how it could lead to delays or even denials of care.
Exactly. And it creates a lot of extra work for hospitals, which pulls staff away from patient care to deal with paperwork and phone calls. And speaking of paperwork, Preyed On includes this crazy story about a patient named Judith.
Oh yeah, Judith's story. What happened there?
Judith was an 87-year-old woman who went in for a routine procedure.
Sounds straightforward enough.
You'd think so. But when the hospital checked her insurance, they discovered she had recently switched from original Medicare to a Medicare Advantage plan.
Okay.
And wouldn't you know it, her new plan had a $300 copay for the procedure.
$300? That's a huge chunk of change, especially for someone on a fixed income.
It is, and Judith was beside herself.
Oh, no.
She told the hospital staff she couldn't possibly afford it. The poor woman was in tears, and the stress was clearly taking a toll.
Oh, man. That's heartbreaking.
Yeah.
So what happened? Did she have to pay?
Thankfully, the hospital was able to step in and help.
Oh, okay.
They used a patient assistance fund to cover part of the cost and wrote off the rest. But it makes you wonder how many other Judiths are out there.
Right.
Facing unexpected costs and tough decisions because of the fine print in their Medicare Advantage plans.
That's a really good point. And it's easy to get lured in by those low monthly premiums, but then you get hit with these surprise costs down the line. It's like playing whack-a-mole with your healthcare expenses.
It is. And this is where doing your research and understanding the potential downsides of Medicare Advantage becomes so important. And that's where resources like Christopher Westfall's YouTube channel and the Senior Savings Network come in.
Right.
They can help you weigh the pros and cons and make an informed decision that aligns with your individual needs and budget.
Right, because choosing between Medicare Advantage and original Medicare is a big decision.
It is.
And it's not just about the dollars and cents. It's about your health and peace of mind.
Absolutely. You've got to consider factors like network size, out-of-pocket costs, and potential restrictions on care. And if you're not comfortable navigating these complexities on your own, reach out to a trusted resource like the Senior Savings Network.
Okay.
They can help you compare plans side by side and make sure you're getting the best possible coverage.
Okay, so we've talked about Judith's experience, which highlights the potential for unexpected costs with some Medicare Advantage plans. But the Preyed On report goes even deeper, connecting these issues to a much bigger picture of corporate profits and influence.
Yes. The report doesn't shy away from calling out the huge profits these insurance companies are making, especially from Medicare Advantage. In fact, they call it the greatest steal in American history.
Wow. Strong words, but do they back it up?
They do. They've got data showing that the top 6 insurance companies raked in over $41 billion in profits in 2023, a massive jump from $5.4 billion in 2003. And they argue that a big chunk of this profit growth is directly tied to the expansion of the Medicare Advantage program.
So while these companies are making record profits, rural hospitals are struggling to stay afloat, and patients like Judith are facing unexpected costs and limitations on their care. It's hard not to see the connection there.
It's definitely a troubling trend, and the report highlights the role of lobbying in this whole equation. They found that these insurance companies have dramatically increased their spending on lobbying since 2003, the year the Medicare Advantage program was expired. It makes you wonder if these profits are being used to influence lawmakers and protect their interests.
It's certainly something to think about.
Yeah.
Because if lawmakers are being swayed by these powerful lobbyists, it makes it even more important for individual voices to be heard.
Right.
We need to let our elected officials know that we support policies that prioritize patients over profits and protect access to quality, affordable care, especially in rural communities.
Right. Don't underestimate the power of your voice. Contact your representatives, share your concerns, and let them know that you care about these issues. And speaking of making a difference, the Preyed On report also highlights the importance of fighting back against deceptive advertising practices.
Oh, yeah. Those ads can be pretty slick. They make Medicare Advantage sound like a dream come true with all those extra perks and low premiums, but they don't always paint the full picture, do they?
Not always. They tend to focus on the positives while downplaying the potential downsides, like network restrictions, prior authorization requirements, and the possibility of higher out-of-pocket costs if you need significant care.
It's like those infomercials that promise you'll lose 10 pounds in a week without any effort. If it sounds too good to be true, it probably is.
Exactly. So be wary of those flashy ads and do your own research.
Right.
Christopher Westfall's YouTube channel has some great videos that break down the marketing tactics used by insurance companies and help you see through the hype.
Nice. And remember, The Senior Savings Network can help you compare plans side by side so you can see the real costs and benefits without all the marketing spin.
Right.
So,
yeah. Shifting gears a bit, the Preyed On report also talks about the impact of these insurance practices on the doctors and nurses who work in rural hospitals.
okay.
They introduced this concept called moral injury.
Moral injury. What's that?
It's that feeling of distress and disillusionment that healthcare professionals experience when they're prevented from providing the best possible care to their patients because of restrictions imposed by insurance companies or administrative hurdles.
So it's like they know what their patients need, but they're being prevented from providing that care because of red tape or financial constraints. That sounds incredibly frustrating.
It is. The report shares stories of doctors who feel like they're constantly battling with insurance companies, fighting for prior authorizations, appealing denials, and generally feeling like they're being forced to compromise their ethical values.
I can see how that would lead to burnout. It's like they're being asked to choose between their patients and their paychecks.
Exactly. And it's a contributing factor to the shortage of healthcare professionals, especially in rural areas. Doctors are leaving the profession or they're moving to urban areas where the working conditions are less stressful.
So we've got this perfect storm brewing. Rural hospitals are struggling. Insurance companies are raking in profits. Doctors are feeling burned out. And patients are facing unexpected costs and limitations on their care. It's a pretty bleak picture.
It is, but the Preyed On report also offers some glimmers of hope that talk about the importance of fighting back, of raising awareness, of holding lawmakers accountable, and of empowering patients to make informed choices.
And that's where resources like Christopher Westfall's YouTube channel and the Senior Savings Network come in, right? They can help us navigate this complex system and make choices that align with our values.
Absolutely. Knowledge is power, especially when it comes to healthcare. And speaking of knowledge, the report also delves into a really disturbing event. The murder of Brian Thompson, the CEO of United Healthcare, back in December 2024.
I vaguely remember hearing about that. Wasn't it a big news story?
It was. Thompson was found dead in his home, and the police investigation quickly uncovered a motive linked to anger over insurance practices.
So someone was so enraged by the way insurance companies were denying care and prioritizing profits over patients that they resorted to violence.
It seems that way. The words delay, deny, and depose were found on bullet casings at the scene. It was a chilling reminder of the intense emotions and deep-seated frustrations that exist within our healthcare system.
It's just awful. And while I would never condone violence as a solution, it does highlight the desperate feeling that some people have when they're trapped in a system that seems rigged against them.
It's a wake-up call, for sure. We need to find a better way, a more humane way to provide healthcare in this country, a way that prioritizes patients over profits and ensures that everyone has access to quality, affordable care.
Well said. And that's why it's so important to have these conversations, to shine a light on the problems and to explore potential solutions. So let's shift gears and talk about some of those solutions. What can we do to fight back against these insurance companies and advocate for a more equitable healthcare system?
All right, so we've spent the last part of this deep dive unpacking some pretty heavy stuff. We've seen how some insurance practices, particularly with certain Medicare Advantage plans, can impact rural hospitals, create financial stress for seniors, and even lead to this disturbing sense of moral injury among healthcare providers.
Yeah, it can all feel pretty overwhelming.
It definitely can, but it's important to remember that we're not powerless.
Okay.
There are things we can do to push back against these trends and advocate for a better system.
Okay, so let's talk action. What are some practical steps we can take to fight back and make our voices heard?
One of the most powerful things you can do is contact your elected officials.
Right.
Let them know that you care about these issues, that you're concerned about the impact of certain Medicare Advantage plans on rural hospitals and access to care. Tell them you support policies that prioritize patients over profits and promote greater transparency and accountability in the healthcare system.
I know it can feel like one voice doesn't make a difference, but trust me, it does, especially when those voices are multiplied. And that's where joining advocacy groups or professional organizations can be really helpful. Think of groups like the American Hospital Association or Physicians for a National Health Program.
Right.
They're working to amplify these concerns and push for meaningful change.
Exactly. There's strength in numbers. And don't underestimate the power of sharing your story if you've had a negative experience with a Medicare Advantage plan, or if you've witnessed firsthand the struggles of a rural hospital in your community. Tell your story, write a letter to the editor, post on social media, or even contact your local news station. The more people who speak out, the harder it will be for these issues to be ignored.
Those are great ideas. And speaking of raising awareness, the Pradon report lays out some specific policy recommendations that could help address some of these problems.
Yeah, one of the most intriguing ideas is the creation of a payer scorecard. Basically, this would be a way to evaluate how different insurance companies are performing when it comes to things like reimbursement rates, claims processing denial rates, and collaboration with hospitals.
So it's like a Yelp review for insurance companies, but with actual data to back it up. I love that idea. It would give consumers more information to make informed choices and put pressure on insurers to improve their practices.
Exactly. Transparency is key. And the report also recommends stricter regulations on prior authorizations.
Okay.
They suggest setting clear deadlines for approvals or denials and imposing financial penalties on insurers who drag their feet or unnecessarily deny care.
Remember, those prior authorizations were a major pain point for Judith in that story we discussed earlier. And for healthcare providers, they're a huge source of frustration and administrative burden.
Another crucial recommendation is to ensure that critical access hospitals, those small rural hospitals that are often the only source of care for entire communities, are reimbursed fairly. Right now, they often receive lower payments than larger urban hospitals, which just isn't equitable.
It's not. And it puts these essential healthcare providers at a huge disadvantage. And of course, we can't forget about the deceptive advertising practices we discussed earlier. The Pradon report calls for stricter oversight of insurance advertising to prevent companies from misleading consumers, especially seniors who are new to Medicare and might not be familiar with all the ins and outs.
It's like they say, buyer beware, but it shouldn't be that way. People deserve clear, accurate information so they can make informed choices about their health care. And that's why resources like Christopher Westfall's YouTube channel and the Senior Savings Network are so valuable. They cut through the marketing hype and give you the straight facts.
Absolutely. If you're feeling overwhelmed by all the choices and all the information, don't hesitate to reach out to them. They can help you navigate the Medicare maze and find a plan that meets your needs and aligns with your values.
It's kind of what we do. Been doing it for a long, long time. And yeah, that's what we do from coast to coast. Now we're in all 50 states and Washington, D.C., if you can believe that. So we can help you in any way, shape, or form, or someone you know that's making a Medicare choice, please have them reach out. Our contact information is right here. It's 800-729-9590, or the easier way is to go to the website where you can literally book an appointment that's convenient for you. So one of our expert agents can actually help you and go through what the choices are, and they're going to show you everything. They're not going to keep something behind them and only show you the most high commission products that are out there. So if you'd like this kind of help, we're here for you. If you'd like to access the reports, the new articles that we were talking about today, the Pradon report, the Senate hearing, the investigation, the American Hospital Association letter, talking about all this stuff that's been going on lately, you can access that in the description of this video below, as well as timestamps part where you can go back to seeing different parts of this if you want to share that with other people. We're here to help you. Please comment below on this video. Please like this video so other people can find it in the algorithm, and we'll continue doing our very best to help people with their Medicare and in the confusion that often comes when they have this critical decision to make. I'm Chris Westfall. Thanks so much for watching. God bless you. Bye-bye.